There's Dr. Allan. I'm a visiting fellow to the University of New South Wales Dementia Collaborative Research Centre in Sydney. I'm currently running a large project around Australia supported by the National Quality Dementia Initiative through Alzheimer's Australia to upskill GPs on the topic of dementia. At the GPCE you get to collect a large number of GPs from just about around Australia. Today's meetings we had people from Victoria, Western Australia, Tasmania, ACT, South Australia, and in some ways that's a good way to capture a number of GPs in one area and also to get interaction within the workshops and understand what are some of the problems that they have, and then get discussion about something from a rural setting or a city setting that didn't have a chance to talk it over with their colleagues. So in fact the colleagues benefit from being in that situation. We talk about the topic, we talk about a problem, and we have very good interactive discussion. So on my side I think that the GPCE forum, and I've been presenting this type of workshop program over the last 3 years, has been very effective in getting to a large number of GPs, perhaps at one workshop or at all 4 workshops, and for them to have an idea of that topic of dementia, to think about the issues and the problems they may face when they go back to their practice. I was retiring from general practice and I still wanted to stay in health and in medicine, and I had an opportunity to take up a GP project about 5 years ago at New South Wales University, and from that I found that, one, I learned a lot, and I do enjoy being a teacher and have done that over a number of years. I always taught my patients about their problems. So I enjoy the rapport with my colleagues, I enjoy educating them, and I also know that I don't know everything, so we have an opportunity to at least get people to think about the topic and for them to consider what sort of things they're lacking in their skills that perhaps we can help them with, perhaps we can direct them to. So I enjoy the honour of presenting the case and talking about the topic, and for them to think about what else they could be doing. And as it happens, I've caught up with other people I haven't seen for a while, and they appreciate that, oh gee Alan, you know something, that's great, you know, I really enjoyed what you had to say or what my colleagues had to say. So I think for myself it's very inspiring to know that people say thank you. On the other hand, it's also good to be part of the education program, which as we get older is changing in medicine. Young guys won't know much about dementia because they haven't seen it yet. Older guys will see dementia but don't quite have the skills of what one would do today. So all in all I think it's a positive benefit for myself and enjoying the education, as well as knowing that people go away with at least understanding a bit more than they did when they walked in the door.